one drink during pregnancy, your kid's not going to have an FASD. However, if you say, like many OBs do, oh, it's okay to have an occasional drink. Occasional, every other day. How big is the drink? We have to be very careful. And also, any woman who carries a child to term doesn't use any substances to hurt their unborn baby. If they carry a child to term, they want a healthy baby. She needs help, or else she needs somebody who actually tells her that what she's doing is wrong. There's a lot of misinformation in the media about alcohol and pregnancy, as you know. However, we don't want a woman to terminate her pregnancy because she was drinking before she knew. It's never too late to stop. We also know that the constellation around her, like nutrition, prenatal care, no tobacco smoking, no other drugs, all of that really has a positive impact. This, I always put this in, you know, we want to be mindful. We have an adopted dad who keeps calling her his FAS daughter. I want to jump off the bridge. You know, and we're trying to get it. If you're in a recovery from substance use disorders, way to go. However, I don't have that disorder. However, I am very neurotic. So I can't use words like addict or drunk. So if you're not in recovery yourself, we suggest that you not use those words either. Because we're people before we're our illnesses. You don't say, oh, he's cancer.
She's borderline, right?
Yes, yeah. So this is a campaign that's been going on. It's not a choice, it's disease. This does make sense. Okay, final thoughts in mind. What's this mean? What do you have to do?
Stretch.
Be flexible. Be flexible. Be creative.
She's very literal.
And work together. This is my last slide. And we'll have some time. This is my nephew. He was a first-year resident at Boston Medical Center, and he was just doing his first deliveries. And that's my little adopted granddaughter. She lives upstairs. She loves Matthew. She was 3 years old at this time. So he comes in, the three of us have dinner, and he says, oh, I'm so excited. I saw two women pushing baby carriages down the street, and they were filled with babies that I delivered. And Lana piped up and said, pregnant women should not drink alcohol. I said, honey, what have I done to you? You all know that. If you didn't know it before I came, you know it now. Okay, it's very serious. There is no safe limit. So that's it. I have some resources for you. And now we have not much time. I have too many slides. So comments. Was this worth your time?
Yeah.
What have you learned that will be helpful to you?
I was definitely just shocked by the prevalence rate.
Mm-hmm.
I think that's something a lot of people don't know, including myself.
Yeah.
Everybody speak up, please.
Sorry, I didn't know about the prevalence rate. I didn't know it was larger than ASD, despite knowing about FASD beforehand. So.
Well, you're ahead of the game that you knew about FASD. A lot of people don't. What else?
Anybody on the phones?
Anyone on the phone have any comments? What was helpful to you? What was not helpful?
I think it was all very helpful. I'm just absorbing it all.
It's a
I'll
lot.
have questions after you leave.
You can email me and you can call me at any time if you have questions, if you have a particular client you're working with and you want to run some things by me.
I would like to do that.
Yeah, that's fine.
I guess one of the things I'd be interested in hearing a little bit more about are not the more obvious cases, but the more subtle cases and how to tease out what's going on there.
I should have included that, and henceforth I'll include the screening tools. The thing is, they're very helpful. They're not diagnostic. And it's always a delicate thing if can you use a tool on a child without a parent's input? I don't know that. However, you can look at them, and they're all behavioral characteristics. Plus, it's good to know about the prenatal exposure, so I think they'll be helpful. I'll send them to you.
Thank you.
Not today.
That's fine.
Okay.
Are there interventional strategies that are based on neurological testing, like EEG and fMRI, that target specific areas of the brain that might be different depending on the spectrum, right?
That's very, very good question. The researchers are now just starting to use fMRI to note the brain damage. However, it's not publicly available now, and there is nothing you can do to the brain. There are no, you can't make any brain changes.
Oh, of course, yeah.
Of course.
Just targeting intervention techniques based on those.
No, you'll know what intervention techniques are needed from the neuropsych.
Mhm.
Yeah, but there will be coming a time when the fMRIs will be helpful in diagnosis, but we're not there yet.
Are there any interventions that would be contraindicated for someone with the fetal alcohol syndrome? Like something where it could present as a different disorder, but if you treat it like that disorder, it will really be harmful if they have?
Well, it is a rule-out disorder,
Okay.
of course, and there are a lot of, even the facial symptoms, there are a lot of other physiological diseases. I think there's like 5 or 6 of them that it can be easily mistaken for. And, I don't know, it's those, you just don't expect, that list of like CBT and group therapy and that kind of thing to be effective. And that might, in fact, delay the growth of that person. If they're in a group, say, and they can't keep up and they fail and they're embarrassed.
Discourage them.
Yes, easily.
There also might be like an increase in problem behavior because we're not
Yes.
accommodating them appropriately.
Yeah.
Are there other medical conditions that also are a result of alcohol exposure?
Many.
So, like, the one I've heard about is Vater's syndrome.
What's that?
It's an acronym.
they're-
Like you can have fistulas. So you can have
Yes.
fistula between the trachea and the esophagus, but
Yeah.
also anal fistulas.
You can have anything. They have
Issues with
web
joints.
hands, railroad ears. If you look, sometimes the kid seems to have really big ears. It's because they have a small head. The ears are normal size. There are a lot of, this young man, Morgan, who I didn't have time to show you, he's got spina bifida. I mean, look at him, he's got a whole bunch of physiological problems. Yeah.
Some of the symptoms seem to be similar to Fragile X syndrome.
And that's one of the rule-outs, actually, Fragile X. And so sometimes geneticists are the diagnosticians. Good for you. I wouldn't know Fragile X if I stepped on it, but. Any other comments, questions?
What I'm thinking is, like, as I was looking at the slides, I was thinking of that child that I have now, and I saw her in pretty much every single slide. And my concern now is in the way that the school is addressing is talking to her about it and going back to her history. Oh, you need to understand that you have this history, and that's why you're doing that, so stop it.
Is it a biological family? Is the bio? Yeah.
Don't think, yeah.
It's much easier without the bio mom, though. I know quite a few birth moms from my national work, and they have all said once they got over the shock and the shame of having done this to their children, they were so relieved to know what was wrong, because they just want to know. And then, Kathy Mitchell said Carly was diagnosed at 16. Up until all they talked about as a family is what Carly couldn't do. And with 16, now they only talked about what Carly could do, and they built on that. Okay, I'm out of time. Thank you. you know where to find me.
Yes.
If you have any questions. And here are the articles for you, Jennifer.
Thank you so much.
And I also forgot an evaluation, so